Carol, I'd like to address the scepticism that is seen in some medical professionals around fibromyalgia in total. Have you experienced any difficulties with the diagnosis and the way that doctors have treated you for the condition?
Yes, I've had symptoms for over 20 years. So if you go to the GP, I've came across that they just kept treating each symptom as I kept going into with a new symptom. There was nothing that actually triggered to say that this might be a specific condition. It was just looking at each symptom I went in with, and it was frustrating because you kept thinking, well, what's wrong with me? Why am I having all these symptoms and yet there's nothing at the end? They've tried different tests and there's no conclusion. However, once I'd actually saw a different GP who had a similar experience in other patients that said, well, wait a minute, there is something that I've read somewhere or that I've seen somewhere, I've heard somewhere, that this collective symptoms that you're actually producing is actually this condition called fibromyalgia. And it's not until then that you start to realise that, wait a minute, I'm not alone. And then you start to do your own little research as you normally do, and you find that there are other people out there that live in the same community, that probably go to the same GP, that have got exactly the same symptoms as you, and they are sitting in a loophole thinking, well, what is wrong with me? Is it all in my mind, or is it, have I genuinely got something wrong with me? And you then decide that you're not on your own, and then you start to think, well, what can be done, or what can the GP do now? And then start to say to the GP, which I did, is, can we look back at all my symptoms, and is it then fibromyalgia?
You run a helpline for people with fibromyalgia. Is this type of experience fairly common?
Very, very common. I set up Fibromyalgia for Wales, and I find there's a lot of men, women and teenagers and family members, that maybe 2 or 3 members have actually got the same symptoms, and they are exactly the same position, that it's taken them maybe 3 or 4 years before they've even actually got to the stage of being diagnosed with fibromyalgia. And the frustrations for myself in trying to help them is that it can be sometimes frustrating because I'm in exactly the same position as them, and saying, well, I'm struggling to get the education across to the GP. I'm struggling to actually get, stop giving me painkillers. Can we treat something else, or can we try something else? And then when I speak to people on the helpline, they're exactly the same frame of mind. They're saying exactly the same, that they're not being, some of them are not even being referred to external specialists.
Did having a diagnosis of fibromyalgia help you?
It did initially, because it was, at last, I've got a condition, that this is real. But secondly, there wasn't enough information out there about the condition, and a lot of the GPs that are in my practice didn't know enough about the condition to take it to the next level of how do we manage this, or how do we treat this.
So how do you think that we can address this scepticism? I
think when you've got more than one patient coming in with exactly the same symptom, there needs to be a flag that comes up to say, right, okay, fine, we need to look at addressing all the symptoms together as collectively. There needs to be, with fibromyalgia, you've got trigger points for certain aspects on the skeleton of the body. So if patients go in and say, I've got neck and shoulder pain, and then go in a month later and say, I've now got elbow and back pain, I've now got ankle pain, then it's not just pain they need to look at. And then they may present irritable bowel syndrome. I think, well, there's something else. So the overall aspect for GPs, it needs to be that they need to now look at the symptoms of the patient historically, so that if over a period of 6 months the GP has seen a patient coming in more than once in 6 months, presenting another symptom, something needs to flag up to say, well, wait a minute, I think it's fibromyalgia. But at the same time, the GP needs a better understanding of what fibromyalgia actually is and how they know and what they perceive fibromyalgia actually means to the patient. Because the quality of life for the patient is obviously less. But the GP, if they don't know enough about the condition, they're just going to continue giving them the same medications, which may be right or the wrong ones.